Hip pain, arthritis, and techniques we use in the office to try to help. I'm going to give you 4 cases of people with different conditions in their hips, different ages, and some pretty good outcomes as well. We did chiropractic care in some of these cases, we did exercise, and my React muscle stimulation table, which I've talked about in other shows. So I'm going to get into that in a moment. You're actually going to see a demonstration on a video of the React muscle stimulation machine in action. Let me introduce the first case, a 69-year-old male. He calls my office. He was referred in by a therapist who knows I have this magnet table. So when he came in specifically for the table. He was already under physical therapy care, and he was already under chiropractic care, so he had those bases covered. But he said, I still have this thing going on, and I want to see if this extra therapy helps. So 4 years prior to coming into my office, he injures his left hip and sacroiliac joint, the big joint in the pelvis, right in the glute area, from a slip and fall. He was diagnosed with a grade 4 SI tear on that left side. So he had various therapy and chiropractic and so forth, and he got to a certain level, but he had a residual pain for 4 years. And some of you with hip problems may know this. So he had pain when he would pivot to get in and out of his car, lifting his leg and coming out of the car. That was one thing that would bother him. It also hurt to walk long distances and stairs. So we put him on the magnet table. We did the first visit, probably 4 or 5 minutes. Comes in the second time, he had slight relief after the first visit. He was happy about that, so was I. After the second visit, he says, my SI joint, that area is feeling more stable. Great, so we continued. After the third one, he said, I'm getting less pain in that SI joint when I'm getting in and out of the car, lifting his leg, pivoting his hip. And that was wonderful. The improvements continued. He's only had 8 visits now, and he's now once a month on the magnet table. He's still receiving care elsewhere. But we've done 8 visits, and he is completely thrilled with his changes. The only thing we did was the React neuromuscular skeletal stimulation table. So in this video here, you're going to see me, I'm getting on the table here, and you're going to see the magnet table working. The magnet is underneath the table, creating a magnetic stimulation which depolarizes nerves and muscles, making the muscles to contract. So it's doing it in a way that you can't do with exercise, and you can't do it with stretching. So you can see that the muscles are activating on this video, contracting the muscles in my glute. In this case, I'm showing you my left hip, my left glute. And we're activating those muscles, stimulating those nerve pathways, rehabilitating the area, getting to those deeper tissues that you otherwise can't get to, attracting new blood flow and nerve flow to the area. Boom. And for some people, not everyone, but some people, they notice a little bit of gain after 1 visit and then more after 5 or 10 or 20 or whatever it is. Doesn't work for everybody, but this was an interesting case where that's the only thing that we did. Okay? Next one is a 74-year-old female. She had her right hip replaced 5 years prior to this story here and recovered well, but now she's having left hip problems, which is a kind of a common scenario, right? So 2 years ago, before we started this therapy, after a gym workout, her low back pain and left hip pain kicked up. She went to the orthopedic. She had left hip x-rays, which were, quote, negative, meaning there was no big bad boo-boo in there, right? She was told she has sciatica and go to see the chiropractor. Well, she had already been a patient of mine, so she comes in to see me. So we did our chiropractic adjustments on the lower back and the hip, and they helped some, but she had a residual. If she sat or driving or longer walks, something that she likes to do, the hip pain would flare up. Okay? So we started her on the magnet table, and again, we'll show this to you again, a video of this in action. She had some relief after the first visit. After the second visit, the relief lasted longer. She was thrilled. I was thrilled about that. After the 4th visit on the neuromuscular skeletal rehabilitation table called React, after the 4th one, she was getting 2 weeks of relief afterwards. So sustained relief, which is really great. She then, in late 2021, she had to sit in the hospital for a long period of time caring for her husband. And a lot of you know, if you've ever been in that scenario, you're sitting in a hospital room, uncomfortable chairs, whatever might be going on, just too long. And that flared her up. So we picked up our treatments on her. We did two visits on the magnet table, and that brought her right back to where she was. She got some flare-ups earlier in 2022, caring for her husband at home, but now she's in every 2 weeks, great relief, super happy. It's definitely doing great things for her hip. So that was that second case. Third case, another 74-year-old woman comes to see me. She has a flare-up of right hip pain after she did a round of golf, okay, something she loves to do. Okay. Now, she had a left knee replacement a year prior to that flare-up. So a lot of the time when you have a joint replaced on one side, you're putting more stress on the opposite side. That's where some of these complications are. So with her right hip problems, she had pain when she was walking, prolonged sitting, prolonged standing caused some problems. In and out of the car, there's that scenario again, was painful as well. Turning over in bed was painful, and of course, stairs hurt too, okay? After we did the first magnet table treatment, it decreased the pain going up and down stairs. She found stairs a little bit easier. After 4 visits, walking was getting easier. She could walk longer and faster, and again, the stairs was improving. We continued once a week for a couple of months with the magnet table therapies, and now we're seeing her once a month for tune-ups with that hip. It's doing much better. It's not 100% much better. She gauged it at 80% improvement overall using that the magnet muscle stimulation. And she's now back playing golf too. Okay. Great case, a great turnaround there too. And you know, very likely if they didn't have x-rays on these hips, that there's osteoarthritis in there too. So a lot of us, we're taught, we're conditioned to believe that when you get a diagnosis of arthritis, that's the sentence. That's it, your joint is bad, it's not going to get better, have a nice life. That's not necessarily the case. Sure, some people need replacements, absolutely. I have family members that absolutely needed replacements, patients that have needed joint replacements, but a lot of people get better, and I've talked about many of these cases on this show where people were told that they need replacements of a knee or a hip or a shoulder or whatever, and they do really well with the care that we are able to offer for them. The last case is a 42-year-old female, 42 years old. Now, she is in great physical shape. She's a great workout person, super good nutrition, otherwise in great shape, but she had this hip problem that was beginning to stir up. Okay, so in this year, in 2022, the left hip problem started to increase and get worse, and it was starting to limit her weightlifting workouts and running. So she came to me late spring, early summer in 2022. I did my evaluation. I said, you need to go see the orthopedic. So she went and saw the orthopedic, had some x-rays, and she told she had fairly advanced osteoarthritis in her left hip. So she had a physical therapy evaluation, and this was good news. You don't get this very often. In the physical therapy evaluation of her hip, they basically said, all of your muscles are really strong, basically because of her working out. There's not much we can do for you. Maybe add a couple of exercises she was shown, and so she's going to continue with home care. So that's good news. So she comes back to me and said, well, what else can we do here? How can we make this hip better for the years moving forward? And of course, she doesn't want to have a joint replacement if she doesn't need one, right? So we start our process, and I showed her a new hip exercise that I had learned in a recent rehabilitation class that I had took. That made it an improvement. We put her on the magnet table one time, and it helped a little, but not great. And in her case, we shifted in another direction. We did the chiropractic care, and we did my low-level laser. I've done shows on that in the past as well. So that's what we've been doing. After 4 visits of the chiropractic and the low-level laser, she has less pain walking, less pain on stairs, and less pain kicking in a pool, the flutter kick in the pool that was bothering her. That's getting better as well. We are only 6 visits in, and she is completely thrilled. She has definitely seen improvements, range of motion, daily stuff, stairs were getting easier for her. So again, we're going to do the best job we can to give her great quality of life and maybe delay a joint replacement. If that is needed, who knows? If that's needed in the future, maybe we can delay that for hopefully a good long time. So once again, even if you have a diagnosis of arthritis, even advanced arthritis, we have seen people turn around with good therapy, with good chiropractic, with the React neuromuscular stimulation unit, with low-level laser. There are options. Look into it. I'm Dr. Scott Fuller.